Hello, everyone. This is Ella Reuter with Becker's Healthcare. Thank you for joining us for today's webinar, Closing Critical Gaps in Healthcare Cyber Crisis Management. Before we begin, I'll walk us through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we will have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have issues with audio or visuals, just try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I am pleased to introduce today's speaker, Courtney Gus, Director of Crisis Management at Sempris. Thank you, Courtney, for being here today. And I'll now turn the floor over to you to get us started.
Awesome. Thanks so much, Ella. Thanks for having me. It's nice to meet everybody. My name is Courtney Gus, and as stated, I'm the Director of Crisis Management here at Sempris. I have a unique background. I haven't always been in the cybersecurity space, so bridging the gap between the business side and our technical and cyber responses. So excited to share some thoughts around how we manage a crisis in a healthcare setting. And like Ella said, please feel free to throw those questions in the chat and we will cover those at the end. And I think what's so interesting about healthcare, and I'm sure a lot of you know this maybe even better than I do, but it's one of those very high target, high impact industries. We see a lot of statistics in the news around how healthcare organizations are targeted by threat actors. And a lot of that goes down to the financial reward they receive. We know that the average cost of a data breach report tells us that the average cost of the impact to a healthcare organization can be over $7 million. And oftentimes, healthcare organizations aren't just good financial targets, they're slow to respond and recover due to the nature of these organizations. So it can be really challenging to recover quickly and really manage that patient care. We often see that threat actors can sit in our environments or live within our environments for over 200 days, 279 to be exact. And that's like having somebody sitting or hiding behind your couch for almost an entire year. You don't know that they're there. So very scary. These impacts can take over 100 days to recover. And actually in healthcare, it could be closer to 150 days. So the impact to patient care and operations can be quite damaging. And a lot of these attacks start with an identity compromise. And that's really because attackers can leverage an identity compromise to really extend the blast radius. By going in through the identity layer, they can actually expand their attack and really start to take down critical operations across the organization. These AD compromises can also be really difficult to recover from because you're not just impacting how doctors and nurses and clinical staffs log into systems like EHRs or IoT devices, all the devices that we use to take care of patients, but we're also managing all of the internal communications and computers. Anything that you log into is something they're going to take down. And the slower it is to get those systems back up and running, the more difficult it is to manage patient care. And that's why the Active Directory layer, the identity layer, can be such an easy target or such a critical target for those threat actors. And a lot of this isn't going to be new for you guys. It's not just about building a plan, but it's really about rethinking the way we execute on these plans. And I think that's what I'd love to challenge the group on today. We've all been building cyber crisis response plans or even business crisis response plans for decades, right? So we've got 200-page run books and playbooks. We've got all of this information at our fingertips. Or is it? Really think about where we're storing this information and what happens when things actually go offline. Will we have access to this information? Did the tabletop we run really get us prepared for what it looks like in real life? And that's really where the disconnect seems to live. The way we prepare for these incidents doesn't actually get us ready for what it feels like when we have to go through something like this. So how can we start to shift our mindset and start building plans that actually help us execute and action much quicker? And that's really, I'd love to get questions and answers after the session, but how can we rethink the way we approach these situations? And the reason a lot of these plans don't work in real life is they just haven't adapted to the way our businesses operate today, especially in healthcare. You think about healthcare 10, 15, 20 years ago, we weren't nearly as interconnected with technology the way we are today. Yes, we've always been connected, but not the way we are today. And our operations are so heavily dependent on the technology we use. What I hear from healthcare providers is a lot of our new healthcare providers are coming into the industry and they've never taken care of patients without leveraging that technology, those tools. So, how do we move from static documentation, tribal knowledge, and kind of that decision paralysis or even authority paralysis into something that really becomes an actionable plan? And part of that just starts with rethinking the way we design these plans and how we train some of those team members. One of the first things is defined roles. We go through tabletop exercises, we tell people what their roles and responsibilities are. But in the event of a real life incident, people are managing their day job and now they've got this crisis management job on top of it. And oftentimes people are really unsure of what their roles and responsibilities are. So, how do we take the guessing game out and just assign them things that they need to do or action on or understand? The next one is really understanding an escalation path. How do we know when to officially shut things off and go to downtime procedures in a healthcare environment? When you're actually leveraging multiple forms of technology and downtime procedures, you can create duplicate efforts, duplicate patient care, and then oftentimes just create a bit of chaos. So, how do we know now's the point in which we switch to a different form of response and recovery? Understanding how we're going to communicate with each other. So, not having any way to communicate is definitely a problem, right? We often resort to our phones or text messaging, but then we end up with too many ways to communicate. So, what happens when we're trying to manage multiple communication streams at the same time while managing patient care or healthcare, and really a lot of duplication of effort? So, clear communication is important, streamlined communication is almost more important. And then how do we take that recovery plan, the one we practice in those tabletops, and really start to make it actionable? It's by creating priorities and also assigning authority. Those recovery plans are going to tell us in what order things need to be restored in. And everyone thinks that the system or tool or technology they use is most important. So it can be really, really challenging to drive priorities throughout the organization. But having some of that understood ahead of time really does help to reduce confusion and really get people moving on the same page. It also allows you to define or develop downtime procedures or documentation on systems that may not be recovered as quickly as others. This one will be down for 3 days instead of 1 day. If that's the case, is there additional downtime documentation we should plan for? And really start to make these plans execution friendly and less about audit. So how do we do all of this when everything's on the offline, when things aren't working, when there's a lot of chaos and confusion as to where this originated from or exactly what's happening? There's a couple things we can do to really start to manage these kind of common failure points. First is just orchestrating the response. In a past life or in years past, we might all be in the same room, right? That kind of command center where everybody comes together. But the way that operations run today, we're often fragmented. We might be in different locations. We could have a regional setup. So how do we create kind of virtual or digital command centers where we're bringing people together and we're really orchestrating that response? We know that the faster we respond and recover, the more we reduce the impact. And in this case, we're talking about patient care, health care. So, how can we really start to orchestrate things? And a lot of that just comes down to identifying a clear commander. Really thinking about the identity piece. If identity was impacted in one of these incidents, we want to make sure that that's restored first. We want to make sure that it's restored cleanly. So, we're not reintroducing the threat actor into our environment because all they're going to do is keep shutting us back down, which can almost make things worse. So it might take a couple of extra minutes or maybe a day to get that identity recovered. But by doing so the right way, we reduce additional kind of ripple effect outages. Build plans for execution, not for compliance. So compliance is great, right? I'm in cybersecurity. I came from the insurance sector. I've been living compliance my entire kind of risk management career. But compliance is really there to help us build smarter plans, build guide rails or guardrails to make sure that we're not hurting people, but not necessarily to help us execute quicker or better. So think about what compliance triggers are critical, which reporting things we have to do no matter what. And then after that, we're just going to make sure that our plans get us back up and running and that we're managing the business effectively. Another big failure point are siloed teams. So we know in healthcare, it's critical that we all work together, but that can be super challenging when you're trying to manage down systems, teams that don't necessarily know their roles and responsibilities, or even groups within the hospital that do different functions. So how can we bring everybody together? I think it goes back down to that orchestration, making sure that we're communicating, making sure that we're orchestrating and everybody's on the same page. And then last but not least is decision paralysis. And I think that actually goes with authority paralysis as well. It's great to understand what decisions I'm responsible for. It's super important that we empower people with the authority to make those decisions. If they're assigned a task or they think that they have a task they need to carry out, but they're not sure they have the authority to do so, everyone will stop. They'll freeze and it'll cause a slowdown. So really, when you practice those tabletop exercises or those practice scenarios, make sure that people not only understand what decisions they're responsible for, but really empowering them or documenting that they have the authority to carry out those decisions. But like previously stated, back to prioritization, the identity layer has to be first. It's not the most fun area of the business to get recovered, right? It's not going to be those applications or systems that help support patient care directly, meaning an IoT device, MRI machines, or other systems within the organization. But the identity layer is what's going to get you into all of those other systems. Identity is that core layer within the business that allows us to authenticate, log in to all of the other systems that we use, patient records, files, systems. And so by restoring that and ensuring that that foundational layer is there and is working properly, it really ensures that the rest of our restoration and prioritization works the way we need it to. And that's very, very important because if the identity layer continues to go offline, or continues to be targeted by threat actors, it will further delay our response and recovery. And the reason I call this out is because it often feels like things are offline or down longer than they need to be. You might be wondering, why aren't we back up and running? Why can't I log into something? I don't understand why this is taking so long. The identity layer can be really complex, especially in an organization where you're logging into multiple systems and tools. But remember, taking that extra time to ensure we get this layer right really makes sure that we can get back up on our feet and we're restoring things the way we need to. So, as far as prioritization goes, sometimes the things you can't see are the things that have to start first. And then we layer in AI, right? So we hear from our leadership teams all the time, we should adopt AI. It helps us drive efficiency, improve patient care, revenue, scheduling. And it's not wrong. It's definitely a phenomenal tool for us to use. I use it every day. But AI, anything that can be used as a tool can also be used as a weapon. And AI is no different than any of those other tools that threat actors use. And the way AI changes our crisis management and our resiliency game, or even our identity security game, is that it makes attacks faster. It makes the attacker more efficient. It also opens up identity vulnerabilities that maybe hackers wouldn't have messed with in previous years. It also connects vulnerabilities together. So AI makes attacking our identity layer easier for threat actors and makes the attack path and the crisis faster for us on the response and recovery side. And I think something as an industry we really need to start considering is shifting from trying to stop all of these incidents from happening. We absolutely have to continue the cybersecurity game. It is essential, but also recognizing that we have to be better at response and recovery. Resiliency is going to be the name of the game as we're managing threat actors in an environment that now has adopted AI. So, really think about not only how AI is being adopted across the organization. Anytime I create an agent, now that agent has access to everything I have access to. So, something to keep in mind, but also how that technology will be used against us. So, when you're thinking about building your crisis management plans or even your identity recovery plans, understanding how you can leverage AI to spot and detect things faster, but also how you should incorporate that in your response and recovery plans. Maybe we detect it faster, but we also need to respond a little bit differently in the way we do our recovery. When we're thinking about I would actually love for you to think about how you could leverage it in the remainder of our conversation today. I think a lot of what we struggle with in the crisis management space is the time to really build plans or rethink the way we need to plan for a strong response and recovery. We don't have time, right? We're juggling lots of important things and tasks, priorities at the business that we need to manage. And planning for an event that we hope never happens can oftentimes fall as a lower priority item. Leverage AI to help you build out your response and recovery plans, but not just build them out, slim them down. Focus on what matters. Move from a 200-page document or binder to a 2-page plan. Imagine what you need to know on your worst day and plan for that. And the first really starts with orchestration. Who's in charge? Who's going to help you manage either disparate tools or siloed teams? Who's going to move you from decision paralysis to execution? Who's going to provide visibility across the teams as to what's priority and what matters? Really make sure that you not only have an orchestrated plan to ensure everybody's communicating, but you also have somebody who's going to help you orchestrate, almost like a conductor, across that response and recovery plan. All of that will allow you to create an audit trail for that regulatory defensibility. So I said compliance isn't that mission critical piece when you build these plans, but if we do this right and we orchestrate things and we have a plan that we execute, we can now create an audit trail for compliance and regulators that we can defend. So what's the difference between planning and exercising versus what really good crisis management execution looks like? And a lot of it goes back to really creating a decision matrix or a decision oriented guide and how we're going to respond and recover. So, how do we create deliberate execution steps? How do we make sure that the team is prepped and ready to make critical decisions across the business? We want to make sure that we have the right people engaged in the process. There's nothing worse than having 300 people in the room, all talking at once, and no one making a decision. Make sure you've got the right group of people in the room. That might only be 30 people, and make sure that they're engaged early. They understand what's going on. And the minute they're no longer necessary as part of that discussion or response and recovery, move them out. Not only does it let them get back to what they need to do, but it reduces unnecessary noise. Like we said before, make sure decision authority is clearly defined ahead of time. If you've got critical decisions, shutting off operations, communicating with internal or external stakeholders, in this case, patients, if you've got specific reporting requirements that you know you need to adhere to, make sure that those decisions are not only outlined ahead of time, but you've got the right authority to do so. Make sure that information all flows through one conduit. I cannot stress this enough. There is nothing worse than having 15 different streams of communication and trying to manage them. People pick up their phones, they start using personal email. The next thing you know, sensitive information is out on Facebook or some other public social media platform. And not only that, as the incident commander, you cannot possibly manage all of those different talk tracks. So find a way to pull out of band communication that's available when everything else is down, and get everybody talking on the same plane, first and foremost. Because from there, you can improvise, you can make educated decisions, and you can really move to what we call the North Star together when everybody's talking on the same page. And I mentioned the North Star because I think this is one of those critical planning pieces that we often miss as organizations. It's really just aligning on what matters to us. And if I were to get 5 leaders in a room ahead of time and ask each of them what matters to the business, what's most important, what's our North Star, I would most likely get 5 different answers. So, one of the first things that you can do as an organization is align on what matters. What's your North Star? And then make sure everybody knows what that North Star is and everyone's making decisions to work toward that. Because if we're doing that, then if I have to make an improvised decision, or if I have to make a trade off that I hadn't planned on as part of my response and recovery plan, if I'm making it and it aligns with that North Star, I can defend my decision. I can explain my decision. So if patient care is first and foremost as our North Star, then every decision I make from there should go back to driving patient care. And if it doesn't, then I need to ask myself, is that priority? Is that something that we should be focusing on now? And if so, why? Because I'm going to have to defend that decision later. So aligning to that North Star allows you to prepare smarter. It allows you to orchestrate better and really make thoughtful decisions throughout your response and recovery. So how do I do this, right? I want to have you guys walk away with hopefully a couple of action items that can make all of this thought track real. How do we actually change the way we build crisis management plans for the organization? And the first one is script the decisions. Oftentimes, when we run tabletop exercises or we build crisis response plans, we do it around a scenario. And those are important: a ransomware attack, an outage, a data breach. It is important to understand how we would respond to those specific scenarios. But we really need to dig deep. If we have to make a decision around communication, tool prioritization or recovery prioritization, or even how we manage patient care, who makes those critical decisions is actually more important than how the outage or disruption started. When you think about response and recovery, there's almost always 2 dual work streams. One is going to be your technical response. And I stop myself there. It could be IR, it could be a cyber response, but it's going to be the technical response and recovery, getting our technical systems, our computers, our devices back up online and operational so we can take care of people. The other work stream or the other response stream is going to be your business response, meaning how do I manage patient care? How do I manage the people or the businesses impacted by this situation? These work streams have to work in parallel and they do have to communicate back and forth to each other, but they have different owners and they have different decision points. So if we're going to shut a system off or one's already down, on the business side, I need to know what my backup plan is, what my downtime procedures are, and who I need to communicate that disruption to. Is it patients? Is it another business that we work with? Is it law enforcement? And so understanding who owns those decisions, what information do they need as you're sharing information back and forth? And are there timelines around any of it? Really helps you execute much, much quicker. So if I assign that decision to you, you know exactly what information you need and how much time you have to carry out that task. And I'm going to show you here how we quickly make that an executable kind of crisis management document. But before we get there, one thing to think about is back to what I mentioned before, that identity layer. If the identity layer is compromised, you've got that technical response and recovery work stream, it's very, very critical that we let them recover in a clean, safe environment. We have seen it time and time again where the business will rush, or not rush, but really try to expedite that response and recovery on the identity space. It will be restored with either the vulnerability still there or the threat actor still in the environment. And the threat actor will just shut you right back down. And they'll do it over and over. I spoke with a consultant who said they saw it 15 times before the business finally said, fine, we'll wait. Think about how much longer that downtime was extended because of those repeated outages. So really give the team time to understand how long it's going to take them to respond and recover. Now, they still need to pre-build in some of the prioritization here. We need to understand how long Active Directory or onshore recovery is going to take. So that way we can build downtime procedures that align. Depending on the type of patient care we do, that may mean diverting patients to another location, rescheduling surgeries or routine care. So it's very important for us to understand how long we believe this might take so that we can manage that business work stream appropriately. So I said we're going to take that decision tree and those prioritizations and we're going to break it down into a super functional workbook. How do I move from that 200-page crisis response binder into something that clearly tells me what my roles and responsibilities are, what my authority is, and the timeline required? And some of that just comes down to taking the decision point. If there's a clock or timeline, putting that on there. And you can always put on any additional frameworks too if it's applicable. Any attributes. What is this impact? Why do I care about it? Why is it so critical? Put that information in there. It doesn't have to be an essay, just so that the person understands exactly what they're solving for and why it's so important. And then who has the decision or the authority to carry out this task? If it's not the task owner, who do they need to go to? Make sure you call that out so they're not running around trying to figure out who they have to talk to. And if it's a reporting task, does legal or anyone else need to take a look at that? Just identifying some of these key items for decision points really reduces confusion and allows me to clearly act on this very, very quickly. We talked about AI having an impact on speeding up incidents. We had talk about how we're not necessarily always prepared, or when we run a tabletop exercise, it could be somebody very different executing on that decision in real life. People's roles change throughout the year. So what information do I need to give that person if they've had no training that will help them quickly understand and execute that task? And that's how I reverse engineer building these frameworks. And again, make sure we're calling out authority. That's one of the really critical pieces. If I have the authority to make the decision, I'll make it much quicker, and I know that it's defensible on the back end. Another thing to keep in mind, and this could literally be a Word doc in your plan, it does not have to be complicated, are understanding critical timelines throughout the year. If you're not a seasonal business, this wouldn't necessarily be applicable, but if you are, why did things in June differ the way or change the way I prioritize things versus December and vice versa? So if you're seasonal in any way, or even if during the time of day, we know that overnight is considered slow versus during the day, it's important to understand those pieces so that way we're prioritizing response and recovery based on peak times. As the incident commander, this is just a quick guide for me to understand what matters to the business and operations during that time of day or that time of year. So that way, again, I'm involving the right team, I'm prioritizing things in a smart way, and I'm getting things back online to align with the way operations run. There's nothing like building a plan for the way we operate in December or noon on a Monday and having this happen at 10 p.m. on a Saturday, and it completely changes the way the business cares about our response. So make sure that we're kind of keeping these things in mind. Again, what's the decision point? Why is it critical? What's my timeline? And then does that change based on either the time of day or time of year? So, what do I do next is usually the question I get when I work with organizations, healthcare organizations, or any business, because sometimes where to start can be the hardest part about either building or rebuilding your crisis management plan. And a lot of it is just don't overthink it and bite it off one chunk at a time, right? Just like we'd eat an elephant. First is really getting in a room together with your leadership team, with your stakeholders, and not just identifying what you believe your North Star is, but as a group, really aligning on that and making sure that it's part of your enablement, your onboarding, making sure that everybody's under the understanding of what matters to us. And in the event of a disruption, this is what we're going to be working toward. And then from there, really start running even small group, but cross functional team exercises. Executives and staff members, IT and the business, bring people together. These don't have to be one day, all group tabletop exercises that shut down operations. Those are very difficult to manage and time consuming. But start to bring small groups together. What would we do if this machine went offline? How would we manage things if our patient care systems, our employee health records or patient care records went offline? What would we do if we couldn't write an electronic prescription? Do we have paperwork for that? Or what if the pharmacy can't reach their documentation on how they compound pharmaceuticals? All of these small simulations help these teams better understand who they need to help during those incidents and what downtime materials they might need at their fingertips if everything were offline. And then from there, really start to test things. So tabletops are great, but if I've ever run a tabletop for you, you would know that the first thing I'll tell you is we're here to fail today. Really change the culture and rethink the way you leverage these experiences. Fail. What's plan B? What's plan C? What do we need to do if all of our plans fail? Who's in charge? And really start to think through testing these systems. Also, test your recovery plans. So, in the case of identity, run an Active Directory recovery test so that you know exactly how long it's going to take you to recover your identity systems so you can build downtime documentation that directly aligns with your identity recovery timelines. Those are all really important things so that we can set reasonable expectations and we can prepare the teams to support patients during those disruptions. I think I went a little fast. I apologize, but I'd love to answer. It looks like there's quite a few questions in the chat. I'd love to answer some of these for you guys too. Ella,
Yeah, Courtney, do we want to start with what is best practice for conducting cross-functional exercises with your third parties?
Yeah, that's a great question. Thank you very much. So when you think about involving third parties in exercises, I think it really comes down to in what capacity are they supporting you and really keeping those to kind of small, reasonable size exercises. So if it's in the healthcare space, I mean, obviously you work with a lot of different third parties. If it's your technical response and recovery third parties, it could be your IR firms, your forensics firms, your legal firms that you're bringing in. In those cases, really just run them through exactly what they're responsible for and how they might be communicating with your patient care teams. What information does your patient care team need from those third parties in order to be effective? And really start to dig into what their roles and responsibilities are. If they are business operations third parties, again, the same. Will they continue to work with you when your systems are down? I was working with a hospital up in New York, and the external pharmacies actually shut off access to the hospital until things were cleaned up. It was a ransomware attack. How can we arrange things with those pharmacies ahead of time to make sure that we can either manually request pharmaceuticals during or prescriptions during that time, or is there another way for us to route information? Another thing is labor. Do we need to bring in third-party labor to support us in a healthcare facility during an outage? Something you'd want to pre-arrange and practice ahead of time. So I think for that question, I would just keep it to small scenarios, small team exercises, and do them frequently. Also, make sure that your internal teams understand who they're working with when it comes to third parties, so they're not surprised. Any other questions, Ella?
Wonderful. Our next question, what's the single biggest gap you see most healthcare organizations missing in cyber crisis planning?
I think capitalizing on tribal knowledge within our healthcare organizations and getting that information down on paper so that it's something that can be shared or even trained on either before or during the incident. A lot of our veteran healthcare providers have a tremendous amount of knowledge up in their heads. And oftentimes we lean on them during these incidents to help us manage essentially manual patient care. So, how can we take all of that tribal knowledge and start to get that information down on paper? I did a really neat exercise, again, with a different hospital group where we went through a tabletop scenario around a real incident they had about a year ago. And I said, tell me the first moment you realized something was wrong. And a clinical leader said the MRI machines were down, kind of unraveled the scenario from there. And I said, okay, based on what you learned in that first 24 and 48 hours of that incident, as a nurse or a doctor, what do you wish you had had your hands on? If you could do it all over, what would you do differently now that you've been through that scenario? And what we found were a good example, a paper example of what a good patient file looked like. A non electronic form was a great place to start. What does a template look like for a patient census? What are the external pharmacies that we use, and how do we manually get a hold of them or request prescriptions? Do we have any prescription pads laying around? So it was really simple things if you think about it, but during that disruption and that crisis were very, very vital to patient care. And they did really rely on those veteran healthcare providers to help pull from those manual processes. So really start to think through, if all the lights went out, what do I wish I had my hands on, and start to build from there.
Wonderful. And our next question, can we request a summary of third party exercises important for key management?
You can, I think, as long as you, I guess I don't quite understand the question, but I'm going to try to answer it and then tell me if I missed anything. Um, you can request that your third parties provide exercises. Whether or not, as part of your third party agreements, they agree to do that, I mean, obviously that would be part of your relationship. If that becomes a critical security requirement for you, or based on what they do for you as a third party, that becomes a sticking point, then maybe you choose another vendor. I think that the third party dependencies and third party risk is becoming very stringent. I also think there's a lot of eyes on it. So I think you're going to start to see critical third parties offer up this information. It's not something that's traditionally part of like a SOC 2 or a security assessment. So that really would be above and beyond. But I think you can ask for anything. Whether or not you're willing to walk away from that vendor if you don't like their answer, I think is really what is going to shift the way we manage third parties. Awesome. Another thing to think about with third parties too is, if you're in the middle of a disruption and your third party shuts you off, they shut off access. Maybe you have an integration, you've got a network connection, and they say, nope, we're not working with you until we're comfortable. I think it's important to understand what comfortable means to that third party. What do they need to have confidence that they can reconnect with you, that they can start working with you again? Because oftentimes they're going to give you a moving target that you can't hit. So if you can predefine what kind of evidence they need from you, that's something that even your IR firms could work on and make sure we get back to those third parties so you can get back up to running or connection quicker. So that's a question we don't often ask, but is owned oftentimes by that third party. So
Thank you so much, Courtney. And how should leaders think about balancing compliance requirements with fast decision making during a real crisis?
I think compliance is an interesting thing. Compliance frameworks give us, like I said, guardrails and a guide as to the things we should care about or focus on. But some of us manage 5, 10, 15 different frameworks at once that can oftentimes be overlapping and redundant or even contradictory. So when I look at a compliance requirement or framework, I try to pull out what are the most critical requirements. What's not just a recommendation, but what could actually result in either a fine or a judgment or further impact to the business. And those become decision points in my crisis response plan. Oftentimes, decision points owned by leadership. If it's reporting within 72 hours, reporting healthcare information to a certain law enforcement or legal body, if it's getting a certain legal body involved sooner, those critical decision points should be part of our quick decision matrix. But the rest of it should, those guidance, items or ideas should just be part of our normal operations from a security perspective. And if we're responding and recovering and managing our North Star, we're almost always going to hit on most of those compliance requirements. And if not, they're defensible. We didn't do this because it didn't make sense because of this kind of thing. So I think what we have to think about in compliance is it's there to be a guide. It's there to support us throughout the year. But during a critical crisis response, we need to think about managing the business and patient care in our North Star and hitting on critical items and not overthinking the frameworks from a response perspective. I hope there's no regulators on the call. Correct me if I'm wrong.
And our next question, if an organization only does one thing in the next 90 days to improve readiness, what should it be?
I think it's going to go back to aligning to that North Star, getting everybody on the same page about what we care about. So that way we're prioritizing accordingly, we're making decisions or improvising accordingly, almost making really smart, educated decisions. And then I think from there, it's streamlining our response and recovery plans, breaking it down to the critical steps to what matters and getting those pieces out to the teams. I think although they sound like small things, those two items can be projects on their own. And I think starting there makes the rest of the steps manageable.
Wonderful. That was our last question. I did just want to make a note that Mary said, please double check the first item in the resource list, building cyber resilience. It's coming up as code only. Thank you. Just thought I'd flag that really quickly for everyone. And those are all the questions that we have for today. I want to thank Courtney for an excellent presentation, as well as Semfritz for sponsoring today's webinar. Thank you for joining us today, and we hope you have a wonderful rest of your day.
Thanks for having me. Thanks, everybody.